welcome to another episode of Boundless Body Radio. I'm your host, Casey Ruff, and today we have another amazing guest to introduce to you now. Nicole Laurent has been a licensed mental health counselor in Washington State for over 15 years. Her current practice focuses on helping her clients with anxiety, depression, and other mental health issues transition to a ketogenic diet or leverages other nutritional therapies to complement their psychotherapy work. She holds several specialized training certifications, allowing her to work with underlying biological factors in mental illness. Nicole works with clients via telehealth and helps people explore medication-free options for their mental health, using research and evidence-based nutritional and functional psychiatry so that people can get their lives back without side effects or dependence on big pharma. In 2021, she created mentalhealthketo.com, a website devoted to educating people about ketogenic diets for mental health and neurological issues. You can find her all over social media, spreading the good news about keto as an option to treat mental illness. Nicole Laurent, what an honor it is to welcome you to Boundless Body Radio.
Thank you. Thanks for having me today.
Absolutely. When I first saw your picture, I just knew that you were endlessly cool. I thought they were blue light blocking glasses, but you corrected me later and said they might not be blue light blocking glasses, but they are orange. You said they helped you see things a little bit brighter when the sun wasn't around, since it's a little gloomy where you are. They're also heart-shaped. They're heart-shaped, which is super cool. And you were wearing a Mindful AF shirt, and I want to say there was like a llama or something on it. Like just pure, straight up, just cool.
Yeah, thank you. Yeah, no, I have that picture. I like it, and I showed a lot of my therapist friends that picture, and they were somewhat horrified that I was going to just kind of use that, like, no, Nicole, let's get you a real headshot. I'm like, no, that doesn't suit me. So yeah, I'm glad you get it. I'm glad someone vibes with it.
Yeah, I totally appreciate that. I'm so glad you're sticking to your guns on that one. Sometimes it's just better to be ourselves and just trust that we're going to attract the right people rather than do what everybody else is doing all the time.
Mm-hmm.
Yeah,
absolutely.
Well, that's great. Well, super cool. I would love to deep dive into this topic. Like I was just talking to you offline about, we've talked to a few other experts in the field that are doing this kind of thing, changing mental health with the diet, which you really wouldn't think those two things are related, and they totally are. So I definitely want to deep dive into that with you. But first of all, I just want to know, how did you get to where you are today, believing that, a ketogenic diet could possibly help mental illness?
Yeah. So I had, everybody, I think, who ends up trying to help other people with ketogenic diets have their own like history of some kind of illness or something that got better with them. So mine was that I had some neurological stuff going on, and I also had just worsening health, and not feeling mysteriously tired all the time, feeling a lot of brain fog, really having a lot of memory issues and that sort of thing. And I had gone to functional medicine, spent hundreds and hundreds of dollars every month on supplements, did what they were telling me to do, had all the expensive testing, and I still just felt really bad. And I kept thinking, oh my gosh, how bad would I feel if I wasn't doing this stuff, right?
Wow. How old were you at the time?
Probably I started to get neurological pain in my early 30s.
Wow.
And so there was like a good span of 10 years there where I was in graduate school, but I was not functioning. I'm like, I look back at my old self, I'm like, wow, you really were. I had a great supportive husband, and I could have never done it at the same time. But I'm like, wow, I can't believe I made it through my graduate program as well as I did, with going through all the things that I was going through health-wise at that time.
Wow, crazy.
So then, yeah, it was crazy. And so then I moved. It had a big move. I moved from Issaquah, Washington to Vancouver, Washington. And I started I stopped seeing my functional medicine person because she was just far away and it wasn't working anyways. For me anyways, functional medicine is fantastic for a lot of people and is life-changing. But for whatever was going on with me, it was just not doing the trick. So then I somehow came across some podcast somewhere or a YouTube video, I don't know. And they started talking about the ketogenic diet. And I didn't have diabetes or anything. And that's what they usually would talk about, a few years ago. That was the main topic. But but they kept talking about all the underlying things that ketones treat. And they talked about it with Alzheimer's, and they talked about it a little bit with, different neurodegenerative issues and memory. And I started thinking, wait a minute, I have some of those issues. I have some of those problems. So, maybe I'm going to try this. And so, I listened to, probably a few, like 50 podcasts on it, and got my gumption up, and I tried it. And I swear my brain energy just unlocked, my memory improved. And what's really funny was my mood improved a great deal. And I'm a therapist. I didn't even think I had anxiety. Like, I thought I had like normal anxiety, just going through life type of thing. But no, I didn't even realize that I had kind of like this low level anxiety all the time. And that just cleared up, but I was functioning well. I was seeing clients. I was teaching them, different therapeutic modalities to handle anxiety. I used that stuff myself, but the bar was low. I didn't realize that a brain could actually feel this much better.
Wow.
And so after I did that, I was like, wow, this stuff is amazing. But, I didn't really talk about it because, the standard of care is medication and therapy. So it wasn't even like anything. I would tell my friends, and I have some great friends that just happen to be therapists, and they're like, wow, that's amazing, Nicole. But it was really scary. I was kind of scared for a few years to talk about it or to bring it up, because it used to be considered such a fringe thing. And in the world of therapy, it's really a taboo topic, because in therapy, we deal with eating disorders. And the current standard of care for eating disorders is there can be absolutely no restriction, or you are potentially causing eating disorders in people, even people who, it's very, very, it's psychology based. It's the idea that if there's restriction, there's going to be anxiety around the restriction or controlling behaviors around the restriction. And so here, it seems very counterintuitive to recommend ketogenic diets, which are now actually are potentially being recommended. Like, there's some randomized controlled trials for binge eating disorder, for example, I believe going on, and there are already published case studies. But anyway, so as soon as you in the therapy world say, hey, there's this diet, it really, really improves mental health and anxiety. Oh, no, you cannot do that. That is going to cause an eating disorder. And there's this huge disconnect between clinical psychology that treats eating disorders and the actual literature about nutritional biochemistry and the effects of highly processed foods and how those hijack brain functioning, right? Wow. But we're not like marrying those two at all. So anyways, I was really nervous. Sorry, I went on a tangent there. I was really nervous about sharing it. But, I'd get like these middle-aged ladies in my practice, and I treat them for trauma, and they still had anxiety, and they're telling me about their diet, and I just know they're hyperglycemic or they already have diabetes. And finally I just started bringing it up. Hey, I heard about this thing, it works really well, right? And a few of them did it and they got better. Like, oh my gosh, someone should have told me about this 20 years ago, right? And then, so I kept kind of doing my thing and bringing stuff up and bringing in nutritional factors into my practice. And then I finally just recently did a clinician training with Georgia Ede about ketogenic diets for mental health and mental illness and neurological disorders. And I think that sitting in there with all those other clinicians that were doing what I was already kind of secretly, kind of scaredly afraid someone's going to take my license doing, gave me the confidence to be like, okay, that's it. I'm doing it. And I'm going to be really out there about it. And I'm going to be, I'm just going to educate. And so then I started my blog, and now I still work with all the people for all the different things like most therapists do nowadays and counselors, but I'm working towards kind of, using that very specific skill set that I have with ketogenic diets and mental health.
Wow, that's really amazing. Cool people know how to find other cool people. I think you and Georgia Ede hanging out is like perfect. She is rad.
Isn't she?
Such
Yeah,
an amazing
she's
human.
the nicest person. Yeah.
Yeah, so amazing.
Yeah.
That's fantastic. It's ironic about the restriction thing because I can certainly understand like if you didn't know what it was and you just like kind of followed like the magazine tabloids, you would just think like, "Oh, you're restricting an entire food group if you do this ketogenic diet," when really it's like one of the most like unrestricted diets you can eat. You can eat a lot of food if you want on a ketogenic diet and almost never feel restricted. And so I get it. It's just kind of
Mhm.
ironic that, it's also a diet that doesn't really require you to like count calories or, grams of fat that you're consuming to be following the diet. So in that sense, it's not really all that restrictive. That's really amazing
Yeah.
that you were able to find all that. If this diet were a pill, was a pharmaceutical, would the psychiatric world just lose their minds?
If this diet was a pill, like if oh,
If there was like a
what do you mean?
medication, like if there was a medication that did what this
Oh,
diet could do, would
oh my
this
gosh.
it would just what completely change the industry?
Oh my gosh. We don't have medications that do what the ketogenic diet does. Period. We have medications that try to zero in on one specific thing. But like I want to make more serotonin, I want someone to have more serotonin available in their synaptic cleft of their neurons so that it can do its effects longer, right? So we'll do things like that, and there's like dopamine reuptake stuff and norepinephrine, and so we just keep trying to come at it with those types of things, and it's so inadequate. Like can we just stop talking about psychopharmacology as though it has saved everyone, because it has not. I am sorry. Taking a lot, I mean, like if you like your medication, that is fine. I am happy for you. I am happy you are alive because of it. I am happy that you are functioning at a level that you feel is okay because of it. I am joyous that you are doing well if you are on psychotropic medication. But we need to really acknowledge the fact that there are millions of people on psychotropic medications because it is the standard of care that are not well. They are emotionally flat. They are having sexual side effects. They don't feel good. The medications are not working well. They have a lot of prodromal symptoms. Like someone with bipolar, great. I'm lithium's fantastic. Or however they keep the mania down, but they're still suffering with a lot of the depressive symptoms because we don't have psychopharm that works really well for that for people. And when people are on psychopharmacology, often, and anyone who's been on this knows, they're like, oh, it works pretty well for a few weeks, and then there's some kind of adaptation that happens, and then people are getting medications for the side effects from the medications. And we have to talk about what those medications do. I mean, we haven't talked about micronutrients yet, and how they're needed to do things like make serotonin in the first place. But we're also not talking about, the nutrient depletion that happens as a result of being on medications. And one of the worst offenders of nutrient depletion are, psychotropic medications. um, you know, Antipsychotic medications deplete nutrients terribly. ADHD medication stimulants deplete nutrients terribly. There's lots of other medications that many of us go on right away, like, hormonal birth control. A lot of the ladies, and then they start getting other symptoms with their mood. A lot of that might not be hormones. It might just be straight up micronutrient depletion because the doctors do not supplement the micronutrients that they know are being depleted, that are being documented in the literature because of the huge disconnect and this huge worship of medications as the way to treat mental illness. And I am telling you, dietary therapy and ketogenic therapies in particular are such a better treatment for mental illness than I think most of the medications. And don't come after my license, Big Pharma, because this is my opinion. But I think it is so superior because it affects so many different pathways in so many different ways. And if you're trying to affect multiple pathways using multiple medications, you are going to have multiple nutrient deficiencies that then set that person up to develop really awful chronic diseases, right? And so yes, dietary therapy is so superior to psychopharm. And I'm so sorry that nobody has told people this.
Wow.
And I'm so sorry that so many clinicians are terrified to talk about it. Like, I think about Chris Palmer, and every video he does, he's like, okay, but this is the standard of care. And I know he believes that. And I know that, and I think, or I resonate with him when he says that, because it is such a strong social vibe that if you suggest anything other than medication, you don't get it. You're minimizing their symptoms. I don't think you understand. I am really sick. I am really mentally ill. I need my medication. So anyone who says anything other than medication, and maybe some therapy as an afterthought is somehow anti-treatment, which is not the case at all. So yeah, that's my thoughts on that.
Wow. Are you passionate about this at all?
Sorry.
I love this. No, it's infectious. I can tell how important this is by the strength of your voice when you're talking about this. That's incredible. And I just think I almost put it like with kind of cancer treatments, where it's like, I'm not going to go out and tell people, don't do radiation, don't do chemotherapy. You should do those things. You should follow your doctor's advice. And you're right. Like, maybe there is a role for certain medications, but even if diet was just an adjunct, if it was just something that kind of helped things along, if nothing else, like, yeah, this could absolutely cure you, but if nothing else, like, it's going to help improve a lot of things, and you probably won't be diabetic, and you can be really, satiated and full with food that you've never experienced in your life. You might improve your digestive issues, your skin health, like so many other things could also improve. And if this is so much more valuable than any medication, it's bananas that nobody's talking about it more.
Yeah.
Wow.
Yeah. And I think part of my passion comes from, I resent the social pressure on my profession to shut up about it. That is what makes me angry. And I think that is why I think that's why I do talk about it the way I do, is that, how dare you try to influence what I know is actually very, very helpful for people, or that I've seen, like the therapists and the nutritional psychiatrists and the functional psychiatrists that use this diet for mental illness have just seen miraculous recoveries. And for there to be some kind of professional pressure for us to shut up about that and to just continue with the standard of care, I resent. It makes me angry, actually. And so, yeah, I just decided I'm not going to shut up about it anymore. And if I get in trouble, I get in trouble. But I think that people need to know that this isn't evident. We don't have a lot of RCTs, but we do have some. And we have been studying the underlying mechanisms of ketones for a very long time. We do know quite a bit. And so this is evidence-based. Like, when I made my blog, I was like, okay, Georgia has her diagnosisdiet.com, which is super cool. Everyone should check that out. And Chris Palmer has his, and his, he talks a lot about bipolar disorder and schizophrenia. And I was like, how am I going to do this? What do I want to do with this? And so what I did is I thought, okay, so what do ketones do? So I did some research on that. I was like, okay, so there seems to be, like, they do a lot, but kind of the four main ones that, that they do is something called glucose hypometabolism. They fix that. They help brain energy. They're great for neurotransmitter imbalances. They reduce inflammation, and they reduce oxidative stress. And I was like, okay, well, gosh, I wonder if that happens in all these different diagnoses that I'm always treating, right? And yes, they do. They absolutely do. Like, there's different flavors, right? So like neurotransmitter imbalances look different between panic disorder and depression, right? But they still exist, and ketogenic diets have mechanisms. They're signaling bodies. They're able to turn genes on and off. They're able to do all kinds of stuff. So they have mechanisms that help with neurotransmitter imbalances. So even though I don't have RCTs for panic disorder, even though I don't have RCTs for social anxiety, even though I don't have the gold standard of RCT, and quite frankly, why would I wait for RCTs? My gosh, people are in pain now, right?
That's right.
Like right now. Am I going to wait 20 to 30, 15, 20 years? There's no money in ketogenic research. This is not big pharma driven. So there's a chance if I wait, these people are going to suffer for 10 or 15 more years, hoping, this research is going to get out. I don't think that's going to happen very fast.
Wow.
So even though I don't have RCTs for these things, there is RCTs for alcohol use disorder, by the way, and Alzheimer's, and soon binge eating disorder, I believe. But even though I don't have them for these specific disorders, does not mean that there is not an evidence base for the use of a ketogenic diet in treating them. And that is the bridge that I'm trying to kind of help people see. So when I write a blog post about panic disorder, for example, or social anxiety or PTSD, I'm doing research on that particular disorder. I'm identifying what of those 4 factors and a few extra, like brain-derived neurotrophic factor, that sort of thing. But gut microbiome is sometimes, is very important in whatever disorder I'm researching. I look at see what identifying pathological mechanisms has the research found. Okay, great, I got it. And then I look at the ketogenic diet. I look at where that's shown to help those things, and then I put those two together in a blog post, and I say, this is why this might help, and here's the evidence. And these blog posts are rich. I don't know if you got a chance to look at them, but they are rich with peer-reviewed research. I am not making this stuff up, people. I'm not some crazy quack who's like, oh, I really like this diet and it was great for me and I think you should use it. No, this is evidence-based. I'm going into the research. I'm researching what the disorder is, and then I'm looking to see what factors the ketogenic diet can help with that. And that's what I'm doing.
That's amazing. This is how I got into this kind of space as well. Like, when I became a nutrition coach, they gave me a big textbook and I had to pass this test, and I have to recommend that people are eating lots of whole grains and vegetables and, limiting their fat and, their portion controlling their meals, and got to make sure there's 3 meals and 3 snacks. And I would give that to people who are paying me money to get results, and it's not working. And it just continues to not work and not work and not work. So I'm sitting around blaming all my clients for being really bad at pulling off this diet. They're throwing away food at the end of the week. They can't meal prep all this stuff. But then all of a sudden, we start to see people who are doing ketogenic diets. They're losing fat. We're seeing it on the scale, measuring body fat. They're losing pure fat. They're not losing, muscle mass. They're not losing water weight or bone density or anything else. Like, what do you want? What do you want me to do when I've got case studies? I've got people who are paying me to lose fat. It's like you. I'm not waiting around for randomized controlled trials. Like, screw whatever I have to do to pass this test to be a nutrition coach. I'm going to give my people what they want. And that's low carbohydrate meal plans that are extremely simple and easy and tasty, and they love them, and you lose fat and you drop your blood sugar and you're never hungry, and it's incredible. And that's, so I can so much relate to that feeling of like, I can't unsee this, and I have to share this with the world. And I definitely want to talk about ketones in the brain and what the mechanisms are, like you were mentioning, but I do want to set the stage a little bit. Can you tell us exactly what a ketone is? Most people, see keto again, like on a magazine at the store while they're, waiting to pay for their groceries. And, maybe they just think of like stacks of bacon or drinking butter in their coffee or something. Can you tell us, what is a ketone itself? How, and what conditions need to exist for one to be, made and present in a certain amount in the body?
Yeah. So ketones, they're a little bit magical. So ketones are both a fuel and a molecule signaling body. And so to make ketones, you can you have to, first of all, you have to have your carbohydrates low enough. And when we're doing ketogenic diets for mental health, for specifically, like, we're not playing. They have to be really, really low, because we want those ketones to be high enough to fuel and repair the brain, right? And so, anyways, I won't be mental illness specific, but yeah, you have to have a low enough amount of carbohydrates, which will then reduce your insulin. And once your insulin is nice and low, your body will start to make ketones. Now, it can make ketones from the dietary fat that you eat, so those butter coffees or those MCT oil coffees or whatever, or, heavy cream, or, all the tasty stuff. Or it can unlock your body fat and burn your body fat and create ketones from those. And the ketones have a lot of, like I said, signaling properties. They turn genes on and off. And that's just kind of the most simplest way to talk about what a ketone is.
Yeah, no, I love that. Thank you for that really clear explanation. And thank you for making the distinction between the two, because this might determine how you want to approach a ketogenic for yourself. If you're approaching it from the mental health side, you may want to consider adding copious amounts of fat or really ketogenic, medium chain triglycerides in the diet to help drive those numbers up. Or maybe you're taking, salts or esters or anything like that. But if you're trying to lose weight, you may approach it a little bit differently and say, okay, once I'm in a ketogenic state, maybe I'm going to eat a little bit less of the fat so I can burn my own fat that I've already stored previously by eating sandwiches for 40 years or whatever it is. So I'm really glad you made that distinction. I love that you talked about ketones being signaling molecules. It's not just a fuel source. They actually tell the body to do so many interesting things. Let's go to your area of expertise. What happens in the brain? Because we know, everybody says that the brain cannot run on fat. It has to run on glucose. I hear that and I get so frustrated. You talk about what is going on in the brain when ketones are available.
Yeah. So yes, there are some itty bitty areas of your brain that require glucose to work. And there are parts of your body that will store glucose, like muscles and a couple of the organs. But you make all the glucose you need in your liver. It's a substrate that your body monitors, and I think, quite frankly, wants to monitor, right? We can only handle like a teaspoon of glucose in our blood at any one time. And your body works really, really hard to keep your blood glucose at that level. So it has a mechanism by which it makes glucose when glucose isn't around, and it keeps it constantly there. And there are just a few parts of your brains that absolutely must use glucose. But my goodness, you do not need to eat them. You do not need to eat glucose in order to get glucose to your brain.
That's right.
Okay. So that's the first piece, is to understand that carbohydrates are a non-essential macronutrient. You will accidentally get some in animal flesh and eggs. It'll just be a teeny tiny amount, that sort of thing. There's a little bit in some high fiber vegetables, but really it's an accidental consumption. Your body does not need a lick of carbohydrates. I promise you. I know that's a super scary thing to say if you've never heard this before, but it is a non-essential macronutrient. Your liver, through gluconeogenesis, will make all the glucose that your brain needs. Okay. We do not want our brain awash in glucose. That does not make our brain happy. That increases inflammation exponentially all through the body, particularly the brain. So we want to keep that glucose low. Okay. So there are inflammatory pathways, and pathways is kind of a fancy biochemistry term. And again, I am no fantastic biochemist. So, but the idea is that you have these pathways and they get turned on when there is some kind of environmental stressor. That environmental stressor can be a whole grain sandwich. If you already have insulin resistance and your body cannot clear that blood glucose out of your bloodstream fast enough, that's a huge metabolic stressor. It can be environmental toxins. It can be, almost getting hit by a car when you cross the street. right? Any type of really strong environmental stressor or toxin or whatever, assault, we'll say, any kind of environmental assault will cause an inflammatory pathway to be cascading, right? It'll turn that on. Well, and we don't want inflammation. There are few things, I mean, all these mental illnesses that I've been kind of deep diving in, my gosh, inflammation is a primary thing for all of them. If your gut, you've got leaky gut and your gut is unhealthy, that's also a huge inflammatory piece that will cause issues. But anyway, so ketones are signaling bodies. So they will literally turn genes on and off in that signaling pathway for inflammation. Ketones reduce the signals for chronic inflammation, which will then reduce neuroinflammation, which will then improve your mental illness that you are suffering from. And that is just one of the things that ketones do. The other thing that happens is that, as we've eaten our really high carbohydrate diet from childhood on, we develop a certain amount of something called insulin resistance. And that just means that our bodies have had way more than that 1 tablespoon of glucose to deal with all these years. And insulin resistance develops. And what that means is that insulin cannot push the energy or the glucose into the cells for energy anymore very well. And so it takes it a lot. Insulin has to go much, much higher in order to finally clear that glucose. And cells become resistant to it. It actually breaks the transporters, for lack of a better way to kind of explain it. And so that happens in people's brains. And that happens, to some extent in people's ovaries with PCOS, right? But we're focused on the brain today. So people will start to have an energy crisis in the brain and not even know it. And so what that looks like is more brain fog, problems with memory. And this can happen, this insulin resistance in the brain can happen as in your early 30s.
That's crazy.
Yeah, it can happen in your early 30s and you'd be like, oh, I'm forgetting things more. It's not a big deal. But it is a big deal and you need to pay attention to it because what it's doing is it's setting the stage for future Alzheimer's and dementia. Alzheimer's is called the third diabetes. It's like diabetes of the brain. And so yeah, that's the thing. So ketones are this amazing fuel for the brain. And even though there's parts of your brains that use glucose for fuel because they just have to fire faster than other parts, your brain loves ketones and they don't even need a receptor. They don't need like a specialized receptor the way glucose does that can get all broken machinery, right? They just go right on in there and they're just instant fuel. Your mitochondria absolutely love them. Mitochondria are these little batteries in your cells, in your neurons, and they make energy. And you have got to have a lot of mitochondria and you've got to have healthy mitochondria. And so these ketones are not just fuel and they actually upregulate how many mitochondria you have and the health of your mitochondria. And when you increase your brain energy to that level, what that means is that your body can repair cells. So if you have had a high, a hyperglycemic or a high carbohydrate diet for many, many years or whatever, or you probably got leaky gut from all that, there's all kinds of stuff. So let's say you've got a really bad case of neuroinflammation and there's a lot of damage that happens with constant neuroinflammation and a lack of micronutrients that you need in order to repair. But you also need that energy component, right? Because that's hard work to repair cells and to keep them clean and to keep reactive oxidative species down and all that good stuff. Like that's a big job. And so ketones provide this really clean burning fuel in the brain and it upregulates that energy. So you start to get out of that deficit, that brain damage deficit that happens with constant long-term neuroinflammation and that oxidative stress.
Wow.
And so, yeah, like I could go on about ketones all day.
I
Like
hope you
that's
do.
what I'm saying. But that's what I'm saying. That's why I get so frustrated that we're like, oh, drugs, pharma. I'm sorry, pharma does not do this, right? So there's some anti-inflammatory properties to like SSRIs, for example. They have a little bit of an anti-inflammatory effect. And quite frankly, I kind of feel like that's mostly the most benefit for them, but there's way better ways. Like the other thing that ketones do are they upregulate your endogenous in your body production of an antioxidant system of glutathione. And glutathione is one of, right next to melatonin, which it actually helps with that too in a different way. But glutathione is like a fantastic antioxidant. I am sorry. Throw away your vitamin C, get rid of your vitamin E. You don't even need that if you don't eat a lot of seed oils. And just upregulate your own body's natural antioxidant system. And it is an amazing healing force for your brain. And ketones upregulate that.
That's absolutely amazing. You're putting on a clinic right now. I love this. This is so important. It's so important for people to hear. This is why I really appreciate the work of, I want to say it was George Cahill, like back in the 60s, where I don't even know if you could pull off these studies anymore, but my favorite study, I love looking at the graphs that show like a person in a fed state and they fast them basically, I want to say for like 40 days. And it shows the different stages where people's cells actually adapt. And the reliance on glucose when the person started was about 100%. And as it, went on and the person went, or people went into deeper and deeper states of ketosis, the need for carbohydrate was a small part of the brain, like you mentioned, red blood cells, which always need glucose, and parts of the kidney, which again, through gluconeogenesis, you can make that small amount of carbohydrate that you need. And you see so clearly on the graph, the brain is actually preferring the ketones. It likes it better, like you explained. I think that's so important to understand.
Yeah, absolutely.
Yeah, so many great reasons to be in this state. And also, like thinking about it from an evolutionary lens, I like to think of it the way Dave Champion explained it to me, where he said there's a state of ketosis and there's a state of glucosis. And if you think the way we would have evolved, there's no way we could have been evolving, relying on a fuel source that is really, rare, unstable, seasonal, and it doesn't provide, long-lasting energy. It's really quick. We would have always evolved in a ketogenic state. We see that in babies. That's why babies are so big when they're born.
Yeah.
Brain health.
No, absolutely.
They need to develop that brain outside of the womb, unlike any other animal.
Yeah.
Wow.
Yeah.
So
the other thing ketones do that's interesting that a lot of people maybe don't think about and the link that it has with neuroinflammation is that it helps balance the immune system, right? So ketones have an effect on the immune system. In fact, there was a study, or not a study, there was a peer-reviewed article talking about those mechanisms and talking about early on how maybe it would be helpful for COVID, right? To put people who are suffering on a ketogenic diet kind of right away to try to use those immune modulator pieces that ketones provide. And that's really important because neuroinflammation is fed by inflammatory cytokines. So let's say, like when you have the flu and you're like, oh, I'm sick. I'm going to sit down. I don't want to do anything. Right. Like you just like, they call that sickness behavior. That's a sickness behavior. And what's happening, the reason why you just suddenly get floppy and want to watch TV and not move a muscle is because your immune system in your body has communicated with your immune system in your brain. And your brain's immune system then starts to send out these inflammatory cytokines. And that tells you to be floppy and to not have motivation to do anything and to just sit still. Like we need to sit still so you can heal. Gosh, that sounds a lot like depression, doesn't it?
Yeah.
Easily overwhelmed. You don't want to get off the couch. Nothing sounds good, right? So ketogenic diets modulate the immune system That's another way. So yes, they're signaling bodies. They're going right after those inflammatory pathways, but they're also modulating the immune system in such a way that it can balance and not overreact to things. And so when you get people who have autoimmune disorders, right? And their immune system is just constantly elevated and is constantly sending that inflammatory cytokine system going crazy with those microglial up there, like these can be really, really helpful. So that's just another piece that some people don't know that I think is really helpful.
Yeah, that's fantastic. No, the weekend the world blew up in 2020. I was at Low Carb Denver in a room full of all these people who are studying ketogenic diets, low carb diets, whatever. And, anecdotally, everybody in the room just kind of like knew that they hadn't really, nobody's been sick. Like they don't get sick anymore. They used to get seasonal flus and all this stuff. And we certainly discussed a few papers that talked about ketogenic diets and flu in particular. But just anecdotally, you just walked around and people were like, well, I mean, I'm going to be careful, but I also don't think I'm going to get really sick with this because I never get sick with anything anymore as long as I eat this way. So I think that's a really, really good point. It's true what they say about, type 3 diabetes. You mentioned that. I think hopefully at this point, there's enough people out there that kind of should know that low carbohydrate diet should help with things like dementia and Alzheimer's. There was that famous clock test. And I'm going to forget the doctor's name who put her husband on it. Her husband was suffering with really severe.
Newport?
Mary Newport. Yes.
Yeah.
And I think he was suffering with Alzheimer's, if I'm not mistaken. And it was a 30-day test where all she was doing was adding coconut oil to his oatmeal. And you see the results from just simply drawing a clock. And the clock he drew on day one doesn't look anything like anything really. It doesn't look, not at all. And by 30 days, it certainly was passable. I looked way, way different. So I think we can appreciate that a little bit more, especially if you're in the low carb space. What things surprised you? Like were there things like anxiety, depression, other things that you didn't, immediately think a ketogenic diet would help that ended up helping a lot?
Yeah. So I would, the way I kind of used it in my practice. So, people would come in with anxiety and depression. Not everyone was on meds. We would be doing psychotherapy. Cognitive behavioral therapy is fantastic. Dialectical behavior therapy, EMDR, behavior therapy, all the evidence-based therapies. We're doing them all. And then, we would talk about nutrition as a component for all the hard work that they are doing. And so sometimes people would need a ketogenic diet to in place of medications. They didn't want medications, or they had medications in the past and they decided the side effects were awful, or that they were sensitive, or they didn't like them, and they were already looking for alternative treatments. So sometimes we would use like a broad spectrum micronutrient therapy. Sometimes we would just supplement some certain vitamins that I kind of, after doing a dietary analysis, I'm like, oh yeah, you're low on this, we better do that. And so I don't do ketogenic diets with everybody, but I haven't seen any that hasn't, for people who do it consistently or semi-consistently, because everybody, when you do a ketogenic diet for mental illness, your carbohydrates have to be very, very low for a while, right? Later, you might, as your brain heals, I do see people's carbohydrates go up a little bit. So they might go from 20 to 30 total grams, not net, total grams of carbohydrates to, maybe 50 to 60 total grams of carbohydrates a day, and still stay in ketosis. And I think that's from the healing properties and the neuroprotective effects that kind of happen. But I haven't seen, for the people who have been like, yes, I love how I feel on this, I'm going to stay on this. Oops, there was a piece of cake, but I'm just going to get back on. It's okay. For those people, I haven't seen a disorder that doesn't seem to respond to it at all, honestly.
Wow.
I do have people though that, like I said, part of it is, the micronutrient depletion from a lot of medications. It's the nutritionally devoid processed foods, inflammatory factors, the types of things. And some people don't need a ketogenic diet. Like if you come see me, I'm not going to push a ketogenic diet on you, but I am going to evaluate your intake of foods. I'm going to figure out what micronutrients you're probably low on. And we're going to talk about how much sugar you eat and how much grains you eat and how that's, I'm going to get a fasting insulin on you. We're going to see where you're at, your blood glucose. And maybe you don't want to do a ketogenic diet, and that's okay. But let's at least get you on some kind of nutrient dense, bioavailable whole foods diet. Like maybe you need to be on paleo for a while, and let's see if your depression gets better with that. And often it does. But for some people, that doesn't do the trick. Those carbohydrates are still too much of a metabolic stressor. They still drive inflammation too high. And we can see that on a blood test. Like your doctor can give you a high sensitivity CRP test, and you can see what your level of inflammation are. There's lots of different inflammatory markers. So I can show them, show a client that, like, look, this year we got something else going on. It might be your diet, it might be your environment, whatever. And that's where some of the functional psychiatry stuff comes in. But not everybody has to be on a ketogenic diet. But boy, is it powerful. And I see it really deal with just about every type of treatment resistant disorder that I encounter in my office. Like, I am not an anorexia clinic. We don't use ketogenic diets for anorexia. I have used them with clients wanting to use them for binge eating disorder and bulimia. I've used them with mild cognitive decline, and I've used them with early Alzheimer's, anxiety, depression, PTSD. I have several bipolar patients that use them. So yeah, sorry, that was a really long way to answer your question, but no, I haven't seen anything that doesn't kind of respond to it.
That's crazy. What a crazy statement to say. And then again, as we, talked about earlier, what about all of the other health benefits that extend outside the brain? I mean, did any of those surprise you?
Yeah. So when I put people on this diet for mental illness, the carbohydrates are very, very low. And so because of that, a lot of people they lose weight. Like I tell them, like, we are not doing a quote low carb diet, because for you, a low carb diet might not do the trick. Although you might get great benefits to your mental health just going on a plain old low carb diet. And there's lots of different levels of a low carb diet, right? It can be very, very low. Like I use with my patients, 20 to 30 total grams a day. And it can be as much as 100 net grams a day, which is way more, right? If you're particularly athletic, it's still considered low carb. And so for some people, they just go low carb and they lose some weight, and it's great. But my patients tend to lose a lot of weight if they need to lose a lot of weight. And so I see them kind of melting before my eyes, because I get to see my clients every week or every couple weeks. And so there's this kind of funny but good, like they're just kind of losing weight. It's just kind of coming off. And they always want to come in and talk about that. That's like what they're really excited about. I'm like, oh no, let's make the other connections. You didn't scream at your kids this week. You didn't start crying in traffic. Did you notice that? Hey, this difficult thing happened and you just took it in stride. That's different than it would have been a month ago, isn't it? Right. Mm. And so they're really excited about the diet. And so that's what I see. So I see reversals of type 2 diabetes in my office all the time. I have education on diabetes. So I'm comfortable talking with them about that. Alzheimer's gets better, but we would expect that. But yeah, skin conditions tend to improve. The other thing that really improves a lot, everybody has POTS nowadays. Have you heard of the POTS yet?
Yeah.
It's this, everybody is passing out or getting dizzy with POTS. And so I see that improve, which is really counterintuitive, because everyone's like, oh no, don't do keto because it's going to ruin your adrenals, right? It's a stressor. Not having carbs is a stressor. So it's going to upset your adrenals, and you're going to get adrenal fatigue or whatever. And so people are really nervous about doing ketogenic diets if they have been to a functional medicine person and told that they have adrenal fatigue. And POTS is often kind of lumped in with that, right? But I see that improve, which is really counterintuitive. I think it improves the sympathetic tone of the nervous system. And for that reason, I see ketogenic diets as really, really helpful for POTS. So yeah, plus the increased salt intake is really helpful. But I don't think that's it. I think it's the ketogenic diet and what the effects it has on the nervous system.
That's amazing. And I can just say anecdotally with the people I've worked with and myself personally, when I went low carbohydrate, my mood and my ability to deal with stress was so much better. It was never bad. Mm-hmm. And I've never had a disorder, but it was so much better. And when I went very heavy carnivore, basically a zero carbohydrate diet where I was just eating meat and fat, it went up even more. I couldn't believe it. That was something I was not expecting and was really amazing to experience. So tell us a little bit about your practice and your website. You are prolific. Talk about blogs. Holy smokes. You write a lot of blogs and they are very well documented, like you said. Tell us a little bit about those and your website and how you're working with people today.
Yeah. So, before I do that, I want to throw one more thing in. Do we have time? Just really quick.
Yeah, of course.
It's kind of it's a caution. So here's my caution, because I know that people are going to be listening to this and they might get really excited and be like, oh my gosh, I'm doing a ketogenic diet. I'm already on medications, but I'm going to do it and I'm going to feel better and I'm excited about it. And that is fantastic. But I want you to be very, very aware that because the ketogenic diet changes the way your brain works and makes your brain work better, that you might actually end up getting symptoms, worse symptoms. And if you get worse symptoms, it is not because of your ketogenic diet. It is because of something called potentiation effects. And what that means is that the medication dosage that you were on, that was what you quote unquote needed to feel better or even, right, is now too high because your brain works so much better on the ketogenic diet. And so about 3 to 6 weeks in, you might need your medications to be adjusted by your prescriber. Okay. So I want you to be careful of that. Before you do a ketogenic diet for mental illness, I want you to go online and I want you to print out the side effects of those medications and I want you to stick them on your fridge. And every day I want you to check in with yourself about whether you're getting those side effects. And if you're getting those side effects, I want you to make an appointment with your doctor and talk about adjusting your medications or the need to adjust your medications. So that is how powerful dietary therapy is. It is so powerful that your brain will work so much better that you have to adjust your medications. That is how powerful dietary therapy is for mental illness. You know what else is super powerful with that is like a broad spectrum micronutrient therapy. Like I'll put people just on a broad spectrum micronutrient therapy that just has really good bioavailable high levels of vitamins, because people, like I said, we're so nutrient deficient. Like I can't even imagine like how I would explain how nutrient deficient we are because of our diets. And even people who move into keto do so probably thiamine deficient, chromium deficient, all kinds of stuff. But anyways, even vitamins, even really good quality vitamins can make your brain works so much better that you start getting these weird side effects. And you always think, this vitamin's making me feel weird. I'm going to stop this vitamin. It is not your vitamin. It is your medications. Go get them adjusted. Be careful. Do it right. Wow. So that's the part that I just wanted to share, because I didn't want anyone all willy-nilly going for it, because I totally would, right?
Yeah.
But, they need to know that piece.
Wow, that is so smart. I don't know why I never considered that. I knew that was the case for things like diabetes and blood pressure medications and things like that. I never considered that would happen. That's amazing. And thank you so much for saying that. We really, really appreciate that.
Yeah. So how I work with people. So I do telehealth only at this point. And I like that because I can kind of work with anybody anywhere. If you're actually in Washington State, I am a licensed mental health counselor just in Washington State. And so you might be able to work with me and get it covered by your insurance for mental health. But for people elsewhere, it's just consultation. And I work directly with prescribers, and I try to coordinate care with prescribers around, those potentiation effects and blood tests and that sort of thing. And so, yeah, that's how I'm working right now. I'm developing some different learning, um, some different learning opportunities. So I'd like to figure out a way to work with more people, because when you work one-on-one, there's really just only so much time in the day to work with that, only so many people. And so I'm trying to figure out a ethical and productive and helpful way to kind of educate people about nutritional therapies for mental illness, maybe an online course or something. I'm exploring that. So if anybody wants to share with me what they want to learn about, they should go to my website, mentalhealthketo.com. And there's a contact me form, and tell me what you want to learn about, because I am doing research for how to help people with that. And then there's also, if you throw me your email, there's also a great little free ebook about ketogenic diets and stress hormones that you might find helpful. And if you have any particular type of disorder, like you have panic disorder, or you have alcohol use disorder, you might really enjoy the blog, because there is probably a fairly in-depth post about how ketogenic diets can help you with your disorder.
For the listener, listen to Nicole, go to the website. There are so many amazing resources and articles. It's very well put together. It's easy to figure out. I love the case studies of people's stories and the things that you are noticing and writing about. And that ebook is tremendous. That is also very well done, very helpful, very informative. I was really happy to receive it. It was, I thought, the perfect balance of being technical, but also easy to understand. And so again, for the listener, I just can't recommend Nicole's website enough. Make sure you go there for sure. You have done such a great job with that. Are you more optimistic that this message is going to get out to more people, or are you more pessimistic that we're going to have too many people that can't, talk about it the way that they want to, or they don't have the same level of, gung ho that you do? You're just going to tell anybody regardless.
Yeah. Well, I think that I'm so grateful for the pioneers, like the Chris Palmer and all the people in the space, Georgia Ede, who have come forward and talked openly about this. And I am super excited about the randomized controlled trials coming out. And I think I am an optimist. And I think that I believe that as more and more randomized controlled trials come out, and it will be very slow trickle, because like I said, there's not a lot of money to be made in teaching people to not eat so many carbohydrates. In fact, the opposite, right? Big Food's probably going to be really mad about this. But I think they're going to trickle out. And I think that it's going to become more and more accepted and more understood. And I think it's going to just improve. So I feel like I'm at the beginning of something really cool that's about to happen.
Good. That's great. That makes me feel better. With things in science, when things come out and it's maybe like a new idea and explodes and it's big and exciting, and then over time, people start to point out cracks and there's weird, things to it. It seems to be less and less true as you go. And things that are really true, the more you talk about them, the more benefits you find, and they become more and more true. The more we test them, the more case studies, the more anecdote, all of it adds up to this mountain of evidence that you're right. I hope it becomes something that people just one day can't even, deny anymore. So right. I'm glad you're optimistic about it. I certainly hope we can share this message with a lot of people. This has been an amazing conversation, Nicole. If you had to distill down one simple tip for our listeners that you would like them to take from this conversation and apply into their lives, what would that one simple tip be?
Oh, one simple tip. I guess it's be curious. Be curious about why the narrative is you really have to be on medication. Be curious about, some people for sure, they need to be on medication, right? And Chris Palmer knows more about those populations than I do, but apparently that's not the case for everybody. But be more curious. Be more curious about all of this. So yeah, I can't really distill it down. I just keep thinking about all these people who they've been told they have a chronic mental illness. And I swear, anything that they can't make go away with a pharmaceutical is now labeled as a chronic illness, right?
Right.
If we can't make the symptoms go away with our pills, then it's a chronic illness and you have this for life.
Yep.
And it just kills me because I know people take that into themselves and then they lower the bar. They lower the bar around what their functioning can be, what their parenting can be, all the things that they could be doing. The bar is lowered. Oh, I have this autoimmune issue, and that means I have to avoid stress and not challenge myself or do exciting things, right? Like whatever. It informs our sense of self. And this narrative that we all have these chronic illnesses that we have to take pills for the rest of our lives, I think is just so damaging. So be curious, question that. That's weird. We are made to function. We are made to thrive, and thriving is our birthright. And if something is getting in the way for that for you, and there is some narrative that makes that okay for you, then we need to be curious about that and explore that and possibly challenge it, because that just might not be the case.
Wow. That is so well explained. I love that be curious attitude. And it's so important because you're right. It is your birthright. And when you see this society that is going through this low fat, high carbohydrate experiment and food pyramid experiment, and you see a lot of people that are very sick all around you, and all of these things are becoming ubiquitous. It really looks like normal when all it is average. It's just average. The experiment did not work, and it made a lot of people very sick. And so I love your message that it is your birthright to thrive and have a good, healthy brain and body for the rest of your life. That's absolutely amazing. Yeah. Nicole, one more time, where would you like people to go to find you and connect with you and your work?
Mentalhealthketo.com, all one word. And you just go on there and go to the contact me form and send me a little contact form, and I will email you back and we'll get you scheduled.
That is amazing. It's so cool that you'd be willing to reach out to anybody who wants to contact you about this. It's such an important topic, and we're so grateful for you, Nicole Laurent, and everything that you've done, this message that you're sharing in such an excited and passionate way. It's so infectious, and I just absolutely know it's going to help a lot of people, and these people, really need you. They're very much suffering, and even the people that don't have, diagnosed disease can benefit from this in some way. So thank you so very much for you and your work and everything that you've done, and being willing to share this and share it with us today at Boundless Body. We really appreciate you.
Thank you so much for having me. I appreciate the time.
Absolutely. Such an honor. And this has been another episode of Boundless Body Radio.